We've got Dr. Ken Randall with Tennessee River Dental joining us today. Always good seeing you.
Thanks for having me back, James. I appreciate it.
We always joke about it's always good when he has his big mouth on this and that. With us, you brought your big toothbrush and your big mouth.
There we go.
We were just having this conversation yesterday with a friend. If you have diabetes, are you at risk for dental issues?
Sure. So there's a pretty well-established connection between dental issues, more specifically something called periodontal disease, and diabetes control and management. Periodontal disease is basically an infection of the gums and bone, the supporting structures in our mouth that support our teeth in there. Lots of inflammatory markers that run through our bloodstream just like any other part of our body if there was an infection in there.
Sure.
And so these inflammatory markers can have a pretty significant effect on our ability to regulate our blood sugar in diabetics, or even if there's somebody that's not a diabetic, still with our ability to regulate our blood sugar.
When you have a patient that sits in your chair and they open their mouth, I mean, can you tell if someone has diabetes and they don't even know it?
Sometimes. So if diabetes is particularly poorly controlled, there are some pretty common things that we'll see with their gums. Also, there's occasionally the ability to smell it on somebody's breath, as wild as that sounds.
Yeah, right. Now, what's the reason behind that?
Yeah, so it basically just has to do with what we call pathophysiology, so the mechanism of gum disease in there, and certain people that aren't able to control certain aspects of the rest of their body's ability to regulate diabetes, same kind of cells, same kind of thing with the gums in the mouth in there.
Yeah. So what would you recommend with someone with diabetes? Do they need to see a dentist on a more of a regular basis?
Sure. So the bottom line is making sure that the periodontal disease is managed appropriately.
Okay.
And so for some people that will be seeing the dentist more frequently, even as much as every 3 months.
Mm-hmm.
Some people don't have the same gum disease issues, so that interval might be able to be spread out a little bit more. But the bottom line is our toothbrush and floss can only clean so deep underneath our gums in there. About 1.5 millimeters on average is what the studies tell us. People that have periodontal disease can have depths in there of 5, 6, 7, 8 millimeters or more. And those are areas that there's just nothing on the home front we can really do to keep it clean. That's where we need some of these professional instruments and procedures to be able to get that inflammation and infection out of there. So
someone without diabetes, I guess if they're going to the dentist on a regular basis to get their teeth clean, on a normal basis, it's every 6 months. But if you have diabetes, you keep up that regimen every 6 months, or? Certainly
every 6 months. Your dentist will evaluate based on your specific circumstances if that needs to be moved up. And even with in people without diabetes, some of them will still have periodontal disease and need to go more frequently. So it's a disease management process in and of itself, but it's certainly still tied to management of diabetes, heart disease, and a number of other medical conditions.
Goodness gracious, you mentioned heart disease, because there's a link not only with diabetes, but with heart disease. You can tell a lot just by looking at their gums and looking at their teeth, can't you?
Absolutely. So one of the interesting things about heart disease in particular is the bacteria that we find on these arterial plaques associated with heart disease are some of the same bacteria that we can find in the mouth in there. There's a specific inflammation marker, what we call C-reactive protein, that's been pretty well tied to both atherosclerosis and periodontal disease.
Great info. Dr. Randall, always good seeing you.
Thank you so much for having me.
Thank you. For more information, Tennessee River Dental. They're located 4845 Hixson Pike, Suite C in Hixson, Tennessee, 877-3848, and TennesseeRiverDental.com for more information.